Here with my good friend Ashley Wright of Mrs. Wright Way. Basically, we want to sit here and talk about pregnancy and chiropractic, how they work well together, how we could benefit each other. Well, at least more so how I could benefit you and everything you're dealing
It's all
with.
about serving the goddess, the pregnant
All
goddess.
about serving the goddess. I'm not going to argue with that. So first and foremost, most common scenario, we're looking at back pain.
Hip pains too.
Hip pain as
Restless
well.
legs.
Restless leg syndrome. That more so may be stemming from, what do we call it, insufficiency as far as like,
Don't tell me I'm insufficient something.
more so on the diet level.
Okay.
Like we're talking like maybe not sufficient prenatal vitamins, because sometimes that could be a magnesium scenario. So sometimes we'll look at what you're taking, what you're eating. But of course, everybody should be on prenatals, right? Yeah, of course, sure. So, but focus, back pain, obviously stemming from a change in balance and center of gravity. Let's just say, for the sake of argument, you had pre-pregnancy perfect, posture, but now because of pregnancy you don't. We can help out with that. Focus is going to be number one, making sure spinal alignment is together. 1 to 2 segments get out of place, it can literally throw everything off. And when I say segments, I'm speaking of the spinal segments of the neck, mid, or lower back. And also, there are going to be a lot of areas of imbalance when it comes to musculature, muscle spasms, maybe be some tension on ligaments and tendons in areas. Later on, we're going to demonstrate not only an adjustment during pregnancy, as well as some key beneficial exercises that might help out. And Ashley Wright's going to help me out with that. She's so excited about the exercise portion.
So excited.
Look at her face. I know it.
However, one of the things alignment does work with, it does help, is making sure that I physically am just operating at my optimal level despite my obvious physical changes. And what I love so much about the Wellness Center is that not only are they talking about making sure my spine is aligned, but that I'm also taking the necessary fitness care to ensure the best labor. And that is something that I know we all look forward to. That is something us as women are consistently planning and trying to make sure we have our ideal birth. So perhaps you can just touch a little bit and share with everyone how that helps with basically just kind of
delivery
giving
process.
the delivery process with everything that's spreading. Like if we are off alignment, do we tend to have more pain or issues with having a successful vaginal delivery as opposed to, if we were aligned and working out as opposed to not?
One thing I always try to focus on is every patient that comes in, I ask them what they want. Not everybody wants to be out of pain. Not everybody wants to have a wellness vaginal delivery.
Yes.
So that's always my focus. So from there, individual care.
I love
It's
that.
personalized. It's not necessarily just a revolving door adjustment, then you're gone.
Right.
Like basically you just said that. I don't even know how I fell into this. It just kind of happened and I liked it. And I just started getting referrals for pregnancy chiropractic. So I did a little research and I started to get into the program of ICPA, which is the International Chiropractic Pediatric Association, where they focus on pediatric as well as pregnancy care with the Webster technique and a couple others. I tend to take and choose what I like from different techniques and use what I like. I try to push individuals into more so of the wellness aspect, to do vaginal, to do less compromised care. And what I mean by that is where they're not doing, say, all of the interventions that come with pregnancy or the delivery, which we can talk about that on another day. But my goal is to help them with that and that alone. And chiropractic helps with that in a sense of, one, from a more specific level, mobilizing the hips and pelvis areas as well as the spinal column. One thing that you will see a lot is that when we find an individual with a compromised sacrum, which is the tailbone, that's going to block everything. Mm-hmm. It's going to make delivery ridiculously difficult. And going back into what we were saying before, with the back pain, let me have you this sideways. So one thing we tend to look at is the curve tends to be compromised because we have added weight and center of gravity on the anterior portion. This lower back curve is going to aggravate, not necessarily aggravate, but increase and put a lot more stress on the muscles trying to keep everything balanced.
Is that the whole we lean back and waddle thing, right?
You said it. I love it. So one thing that we do, help with alignment of the sacrum tailbone, and then work with strengthening of the muscles of the lower back. In turn, plus, like I said earlier, she's excited about, we're gonna jump into in a minute.
What, you mentioned the Webster technique. What exactly is that?
Great question. So basically, focus is working on alignment of sacrum, pelvis, leaving spacing and room, and removing tension away from any of the ligaments and tendons in the area for proper baby positioning.
So that's really good, because I know that's something that is a concern of mothers. That's often, so chiropractic care can help with proper baby birth positions.
Yes, indeed.
That's awesome.
Awesome.
And you know, we talk about like just, I think it's not as common for people such as women like ourselves. We have a lot going on, and so to know that there is a care that's provided that are doing the extra stuff, thinking about our sacrum, like we're just not even thinking about that, or how that even
Well,
plays.
you got a couple other things on your mind.
Exactly.
I can understand.
Exactly. Just how to get up in the morning. So it's awesome to know that is something that is inclusive of chiropractic care.
Indeed. Okay, so transitioning from what we were talking about earlier, basically I always ask patients, what is your birth plan? How do you envision how this process will go? Do you plan on doing vaginal, or okay with doing a C-section? You want to go to have it done in a hospital, or are you okay with a home birth? Are you interested in doing any kind of intervention? I always encourage all of my patients to put pen to paper, write out your ideas, figure it out what it is that you'll want to do, and that way you'll have less confusion, less concern, less frustration, and you'll have a better idea on what to tell them. Because also, another thing, when you're going to a hospital, you're hiring them. You tell them what you would like to do. Don't let them tell you what to do. Make your plan. When it comes to, I recommend some form of meditation, whatever that may mean to you. Some recommendations, I'll say visualization. Sometimes I tell my patients to visualize what your baby will look like, or what the whole process will feel like when you're going into labor, pushing the baby out, or transitioning into holding the baby to your chest. Put these things on paper. Also, what other things do you have in line for walking, fitness? Maintaining these other things are all scenarios that I include to the regular visits that we have for chiropractic. One thing that people do not know about chiropractic, especially when it comes to pregnancy, that it is something that should be included, in my opinion, just as regular as your regular doctor's visits are. Beginning stages of pregnancy, say first trimester, on average without complication would look like maybe once a month. And of course into the second trimester and third trimester. Some people ask questions if you can have chiropractic throughout the entire pregnancy. Affirmative, yes, you definitely can. I've given adjustments up until the same week of delivery. And the reason for this is to maintain that brain-body communication. During the pregnancy process, there's a lot going on. You don't always know how to process it. Your body doesn't know how to process it. So that's where this comes into play. Chiropractic aspect of everything should be included into your birth plan. So now, I think Ashley's ready for her adjustment. What do you think?
Hell yeah.
I love it. We are ready for this adjustment. We've already went through the exam, prone, face down, where we would look at and focus on any of the limitations on the sacrum, pelvis, lower lumbar, as well as cervical and thoracic spinal segments. as well as supine facing up, assessing any tension alongside any of the ligaments, round ligament, as well as the psoas muscle. So at this point, we're going to move on to the adjustment. So have you lie on your back?
You know I'm old, so.
Nah, you ain't nobody's old. All right, cool. So at this time, we're just assessing what levels we need to focus on for the adjustment of the cervical spine. All right. Have you place your hands on your belly. All right. Awesome. Awesome. All right. In some cases, we can do the adjustment face down, but I much rather prefer just having her in the back. Obviously, if it's a face down adjustment, it is a proper table which dips in, or the pregnancy pillow. But for sake of demonstration, we're going to do a supine adjustment for the thoracic spine. Awesome. Awesome. It smells like those. All right. Great. Now at this point, we're going to do the lower lumbar as well as the pelvic and sacrum alignment. So I have you lie on your side facing me. All right. It's your favorite. Come on, you can do it. All right. I promise I will not drop you off of this table.
By the way, there's activity going on behind us. Family-centered care.
Awesome. All right. Face the other direction. And come on, I got you. All right.
Oh, guys. I'm so pregnant.
Just a little. Awesome.
So
All right, on your back.
What do we do now?
Let's see if we have any leg length differences, which we do. We have a little bit short on the left leg.
Oh, I actually felt that.
Nice. Good thing her feet don't stink, so we're in a good place right now.
You're welcome.
Hey. All right. Sometimes as I mentioned earlier with positioning of the baby, we want to focus on certain ligaments. So one of the things we like to look at is the psoas muscle, which I guarantee you is not a fun exercise or demonstration for her, but it definitely benefits. So the psoas muscle transition from the lower lumbar spine comes down into the inner thigh. We're going to work on releasing that right now. All right, so there's only one rule. You ready?
Yeah.
Don't punch me.
Okay.
All right. All right, good. Yeah, so I just have edge blade onto the muscle, and I'm just moving this around. I'm putting a little bit of pressure. She feels it, but I'm not aggressive. All right. Loosen it up. Then we transition to the other side. All right.
Can they see?
I think so. All right, knife edge. And I can feel the muscle engaging. I know pretty much when it's loosening up. All right. Come on up. And that concludes your adjustment. Awesome. Good job. Love it. All right, so you just experienced an awesome adjustment. I appreciate Ashley for helping me out with this demonstration. Please, please, please. This young woman is remarkable. I look up to her, and we trade secrets on a regular basis. Miss Wright's way.
You're too kind. You can check me out, follow the rest of this pregnancy journey as we navigate through health and wellness at Instagram, Facebook, Twitter, Ms. Wright's Way. That's MSWRIGHTSWAY. Once again, it's always a pleasure to be adjusted by you.
The love.